After years of decline, rates of advanced prostate cancer are on the rise, which in part may be due to changes in PSA screening guidelines that occurred in 2012, according to a new report from the American Cancer Society. American College of Surgeons experts James Eastham and Robert Brookland are available to speak to media members about this concerning trend and what men can do to protect their health.
The routine use of PSA, meaning every man got a PSA test, and if it was a smidge elevated, it would lead to a biopsy. And if that biopsy showed a smidge of whatever type of prostate cancer, it would lead to treatment. That's what got PSA appropriately questioned as a routine test. With knowledge and experience, no one nowadays is recommended for a biopsy or should be recommended for a biopsy based on one little blip in PSA. So there are a lot of secondary screening methods. We cull out many men that don't even go to biopsy because they're unlikely to have a significant cancer. There's second-line screening tests. If we do a biopsy, we typically now involve imaging with MRI so we can do a better biopsy. And if cancers are low risk, we basically don't treat them. We put the patient on surveillance. So the benefits of PSA screening, meaning identifying cancers that are potentially lethal and treating those at an earlier stage, now don't have the backdrop of lots of overtreatment, lots of unnecessary biopsies, lots of angst. Now I think because of the second line screening tests, not everybody getting a biopsy, not everybody getting recommended for treatment if they have low risk cancers, I think the benefits of PSA testing have now just markedly been enhanced. And I think men should get a PSA test.
For a non-smoking man, this is the most common cancer to be diagnosed with. 1 out of 7 men will have prostate cancer, maybe a little more. Many prostate cancers, once identified, can be monitored closely with their physician. And I think a urologist is well positioned to monitor this disease with them. So there are men who have prostate cancers where observation is not the right choice and treatment should be considered. And there are multiple excellent treatments using radiation treatment or surgery, both equally effective treatments for many men whose prostate cancers require treatment. So most men who are found to have prostate cancers are not going to die from prostate cancer. It is a very treatable disease, but our success rates are the best when we're dealing with the disease when we find it as early as we can.